Hey guys, this is Dr. Hub. Now let's look at the vitamin D and the vitamin C deficiency. So a comparison. So first we start off with vitamin D. So what is the pathology here? So in terms of vitamin D, the pathology is there is a poor mineralization of the bone. So there's poor mineralization of the bone. And next is, what are the clinical features of this? So clinical features of this is there is a no or less irritability. There's no or less irritability, and there is also presence of the rachitic rosary. So this is in terms of the vitamin D. So there's presence of the rachitic rosary. So what do you mean by rachitic rosary? Means that there is a nodularity at the costochondral junction. There is nodularity. So nodularity is present at the costochondral junction. Next is we move on to finding the radiological features. So under the radiological features, there is presence of, this is all in terms of the vitamin D. So there is presence of the cupping. So there can be presence of cupping. There can be presence of the fraying, as well as there is presence of the splaying. So this was about the vitamin D. Now moving on to the vitamin C. So in terms of the vitamin C, what are we seeing? So here in vitamin C, it is the pathology is poor osteoid formation. There is the poor osteoid formation. And what is the clinical feature? The clinical feature is that there is irritability. So in vitamin C, there is irritability is very prominent. So there is irritability. This is going to be very prominent. Then comes the question on the scorbutic rosary. So in terms of the scorbutic rosary, here it is going to be angular and sharp. It is going to be angular as well as sharp at the costochondral junction. Next is a question on the radiological features in terms of vitamin C. The RF, that is the radiological features, there is the white line of Frenkel. There's presence of the white line, and this is nothing but of the Frenkel. And there is also presence of the Pelkin's spur. There is Wimberger ring. As well as presence of the subperiosteal hemorrhage. Now there is a very important concept to note, that there is irritability present in vitamin C deficiency, that is the scurvy. So this irritability is due to the hampered neurotransmitter production. So there is hampering of the neurotransmitter production. So here there is conversion of the dopamine to norepinephrine and tryptophan to serotonin. So this requires the vitamin C. So this is involved in the conversion of dopamine to that of the norepinephrine and the tryptophan. Tryptophan to that of the serotonin. So all this, it requires the vitamin C.